spider veins is just more of a aesthetic look. It's the varicose veins that cause a lot more pain, and
Mm.
then because they fill with blood and they can put pressure on a nerve or something like that.
Mm.
But spider veins are more aesthetically pleasing, and women, we really do have a hard time with that.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Andrea Carrillo of True Health. She's been a nurse for a total of 16 years and a nurse practitioner for the last 6. Her work history includes the ER, ICU, medical and surgery, hospice, home health, and aesthetics, but not limited to other specialties in nursing. She started her small business performing aesthetic procedures such as Botox, dermal fillers, and scleropathy 14 years ago. She loves helping her patients achieve their goals, whether it be through weight loss, nutrition, or other aesthetic procedures. So Andrea, welcome and glad to have you here.
Thank you. I'm very glad to be here.
Yeah, so let's dive right into it. How did you first get interested in medicine?
I think I've always had that knack for it. My mom was a caretaker and caregiver just naturally, and I always wanted to help people. I originally thought I was going to be a teacher, so I had a bachelor's in education, and then I changed my mind right before I was going to go for my master's and started school all over again. And I think that just has to do with all of the familial things that I had going on. My sister has seizures. She's developed them since she was 7,
Wow.
and she's had almost any type of seizure that you could think of. And from there, I stayed with my grandma. My grandfather died whenever he was 8, and I loved taking care of her. And I just think it's a very important part of people's lives that sometimes are overlooked quite often. And to have somebody that can speak up for them and talk on their behalf, especially when they don't know a whole lot about what's going on with their medical care. So that's probably where it started from.
I see. And then how did you make that transition over into aesthetics? Because I mean, you have a pretty wide background when it comes to almost everything medicine.
Okay, so this is a funny story, and I'll try to shorten it up. But I was actually attending a hospice a funeral for a very affluent client or a very affluent patient, and at the end of the funeral, I was kind of making my rounds and saying bye to the family because I had become very familiar with them and very close. And some of the people at the funeral came up to me and were like, "Oh my God, when are you going to start doing Botox?" And of course, this blank stare on my face. And I'm like, "What are you talking about?" Well, they had confused me for another nurse that this family had known that was going to go start the procedures, the process. And so I go home and I call my friend who had introduced me to them in the first place. And I said, "What are they talking about?" And they're like, "Oh, they must have confused you for Ashley." So her name starts with an A as well. And I said, "What? RNs can do this?" And she's like, "Yeah. You just have to have a medical provider that signs off on all your procedures until you become, a provider yourself." That's exactly how it started. So I looked into the classes. I went to NLI and I started taking Botox, basic Botox and filler and sclerotherapy. And then the next year, within like 6 months, I took the advanced courses. And from there, I started doing microneedling. And I've even learned liposuction, believe it or not.
Okay. I guess that comes from the surgical background, right?
Yes. It's really interesting. And I thought it was going to be much harder. You are a little more forceful than you think. My mindset, I was kind of like, oh, I could do that a lot easier. No, you have to really get in there whenever you're doing lipo, but it's really a fun procedure. I personally haven't done it in my clinic, but I've taken many courses on it.
Got it. Okay. So now you've had this practice, you've had it for 14 years, a long time. So what would you say are some of the most common treatments that you provide to your clients within your practice?
So the most common that we do now is, of course, IV vitamin therapy. That is one of my most favorites. So many people are deficient in vitamins. They just really don't realize it. And of course, it has to do with convenience, the way that we live and don't live off the earth, et cetera, those things. And I do hormone therapy, which is also another medically necessary procedure that people don't often realize that they need. So there's like a big stigma that they think only men need testosterone. And it's not true. I, as a woman, need testosterone just as much as you do. I just don't need as much as you do. And then, of course, that also goes for estrogen and progesterone. And you often hear people think that men don't need that. So under those things, progesterone helps us sleep. Testosterone is very responsible for not just muscle mass and loss, but it's responsible for our sleep cycle. It also helps with our bones and joints. And the list goes on. Libido, to name another one.
Okay.
And of course, aesthetics. I've been doing aesthetics for 14 years. So yeah, I love aesthetics, especially treating the older population a little bit more. because the young population, I mean, they're so into the lips and those things, and they're really easy to treat. Not to say anything mean, but it's not very hard to treat a very young face. So I really like helping maintain the aging woman or the aging man.
Got it. Okay. Now, in your introduction, I mentioned as far as scleropathy is what you do. Now, I don't think I've ever heard of scleropathy
Oh
before.
no.
So could you explain what it is?
So scleropathy is where we take a solution, mostly 23.4% normal sodium and sodium chloride, and we mix that with some lidocaine just to help numb the process because it can be a little stingy. And we inject the small spider veins from the waist down. We don't do anything other than that from the waist up. If it's like a varicose vein, we don't touch those because those need to be cauterized by a surgical, a surgeon, a vascular surgeon or a cardiac surgeon. But those, we do that. And if they have like the big purple veins, sometimes they have like the large clumps and it gets rid of them. Sometimes it takes a few treatments. Some people just need one or two. And I mean, it's very nice aesthetically, especially for women who have trouble with showing their legs because of those. If they're on their feet often, they develop them more than someone who's not.
Okay. So it's really for treating spider veins then?
Yeah, spider veins.
Okay.
Mm-hmm.
Okay, got it. So for this type of treatment, is it, and you mentioned that you tend to work with more the older demographic. Is this something that is more consistent with the older demographic, or is it all ages can suffer from it?
Oh, there's all ages, believe it or not. It's funny that we don't realize how much being on our feet, where we're standing on our feet, what types of shoes we're wearing, athletics, and then of course familial history. I mean, I've had women in their 30s that have some pretty severe spider veins. Men don't seem to have them so much, and I don't know if that's because you guys just develop better vasculature, but we do treat men as well.
Okay, so you have the treatment part of it, but as far as the preventative part of it, like, is there much you can do from a preventative standpoint to prevent getting spider veins?
Well, yes, massage is a great one because it causes recirculation, right? Having great blood flow, like having nitrous oxide in your body, that's another great supplement people don't understand that they absolutely need. We have that in our blood supply. And because of our diet, we don't really consume enough of it. And then, of course, wearing like Ted hose or the real true best supplement to wear, or let's say like not Ted hose, but pantyhose, because it actually brings the blood flow all the way back from the toes, all the way back up to the waist. So if people could wear pantyhose, I know it sounds very outdated, but my mother wore pantyhose every single day of her life, and she never developed cellulite nor any spider veins.
Interesting.
So I don't do it. I say it all the time, but I mean, it really is a really good preventative measure.
Yeah. Okay. Now with the spider veins, is that something where it is more of a aesthetic look, like trying to get rid of it, or are there more health consequences if you just leave it to its own devices?
Usually spider veins is just more of a aesthetic look. It's the varicose veins that cause a lot more pain. And then, because they fill with blood and they can put pressure on a nerve or something like that. But spider veins are more aesthetically pleasing. And women, we really do have a hard time with that.
Okay. And so I'm curious, how did you end up getting into this specific field? Because again, I don't think I've ever talked to someone who really talked about this at all or did this, and like I don't even know what it was. So like, what got you into this specifically?
In sclerotherapy?
Yeah.
So when I went to NLI, it was a course that they had offered, and I'm always interested in learning, and I was going to be there. And to add the course, it wasn't as expensive as if I took it by itself. And then I got there, and we had a lady that she was a classmate of ours, and we got to practice on her, and she was covered in them. And she just kind of talked to me and told me how it was very hard for her to go swimming with her grandkids, to even wear shorts on a daily basis. And to me, I think when somebody is hit that hard with something that bothers them like that aesthetically, it really affects them, and it can affect them mentally. So I just wanted to start doing it from there. And then, I mean, I kind of have some, so I was like, well, I could treat myself.
Okay. Now, we talked a little bit about some things you can do to try and get rid of them or prevent them from coming up. But is there any like things that you should not be doing? Like, don't do this because there's a high chance it's going to lead to getting spider veins.
Well, I think the biggest thing that we should really focus on is our shoes that we wear. I mean, I've been guilty of that in the past, running around a clinic. I some days get about 5 miles in my clinic. And there was times I was wearing high heels, 3-inch heels, and that's not very bright. I knew that wasn't good. So things like that, as I said, drinking water, getting enough nitrous oxide, things that'll help with your blood flow. So that way nothing stays pulled into your lower extremities. It actually returns to where it's supposed to go. And that's what helps develop those spider veins, is because of that little bit of blood actually gets caught into those tiny vessels, and then you can't get it out of there. So the only way to get it out is to inject it with the sodium chloride.
Okay. So shoes is one thing. Make sure you have good shoes. And when you say like good shoes, are you looking for like kind of flat shoes or like just not high?
Something with a good comfortable arch. I like to wear Nikes. I know I probably shouldn't be saying a brand, but that's the shoe that I prefer. But I mean, New Balance, anything that really gives you a good arch, a good support, nice and cushiony, comfortable. There's a lot of people that prefer Crocs. What's the ones that the nurses wear? I could never get on those. I felt like I was going to fall everywhere I went. But I think you know what I'm talking about. That real big heel.
Yeah. I can't. They're like Crocs. So they remind me of Crocs, but yeah.
Yes, they remind me of Crocs. But a lot of women say that those worked for them. I ordered a pair once, and I could not walk around the hospital. I felt like I was going to fall everywhere I went. But good shoes is very important. I think stretching is another benefit. People should really do that more on their day-to-day basis. And then of course the massage. I think insurance should pay more for massage than they do other procedures, but massage would be a great way to get that circulation back up to the inner part of the body where the heart is and the lungs, which causes the circulation.
Okay. Now, what are some myths or misconceptions you've heard when it comes to scleropathy, or I guess like having spider veins, getting spider veins? What's some of the most common misconceptions and myths that you've heard about it?
Number one, that you can't get rid of them. People think that just because they're there, they're set to be there, and they're very skeptical about the procedure. So sometimes I have to really talk them into it and, just kind of tell them, hey, this is going to be a series of treatments. Some people need more, as I said, but I think that's probably the big misconception, that they're there for the rest of their lives.
Okay. And when you actually start doing the treatment for them, you mentioned it's going to take a couple treatments. Now, I'm sure it's going to depend on severity and their own individual situation, but about how many treatments would they need to get before, and can they get rid of it completely, or is it just kind of like more slowly, like getting it to fade a bit?
So on average, it takes about 3 to 6 treatments, depending on the person, and you can get rid of them completely. I've had people we've had giant clusters, and we inject that, what we call the eye of the cluster, and you'll actually see it feed through all those little veins. It's really cool to look at. We put a vein light on it, and it's a very meticulous procedure. I'm not going to lie. We use a 30 to 31 gauge needle, and so you have to have a great eye, great hand, but it'll get rid of them completely. Now, the thing about that, though, is that there's people that tend to develop them constantly over time. So some people need more treatments than others. Some people just have a few, and they can come back in a year or two or so on. But I mean, you can get rid of them. You can make your legs look a lot better.
Wow. Okay. Now, I'm sure you get this question a lot, and I think you kind of alluded to it before. Like, is this painful to do this treatment?
It stings a little bit. I'm not going to lie.
Okay.
And there's areas that don't hurt at all. Like when I've done my thigh, that seems to sting a tad, but like the calf area for myself doesn't hurt at all.
Oh, okay. Okay. So, and have you had people come in who just believed that it was impossible, that there was no treatment, that they were just going to live with it for the rest of their lives?
Oh, absolutely. And I'll just take the lady that was my classmate. She was very skeptical, because you take the didactic portion first, and you read all the literature, and you get to see all the videos and the before and afters, and she was still very skeptical. And then once we all got to practice on her, she was amazed. She actually left there crying that day because she could not understand or did not believe that she could actually get rid of them. And I thought that was a great thing, that she could see some relief.
Yeah. Okay. Now, I'm curious, because you also mentioned IV therapy. I'd like to dive a little bit into IV therapy before I go kind of deep into that one. Can IV therapy also help with the spider veins as well, at least like helping to prevent, or is there any correlation between, or like completely separate?
No, I mean, of course, IV vitamins can help, because if we can cause a better blood flow through you. And often people don't understand that if they don't take in enough sodium chloride, then they're not going to get great blood flow, because you need enough sodium chloride to travel throughout your whole body, because water loves salt, salt loves water. And those smaller vessels will be treated through that, and it'll help with circulation. And plus there's other medications that we can put in those bags that help with circulation, like niacin for one, and arginine. Arginine is a vasodilator, and niacin, of course, causes a vasodilation through its red flush, and because it's a B vitamin. So those 2 vitamins in particular are really great for treating spider veins. So when I do have somebody that has a severe case, I do try to offer that as an adjunct therapy.
Okay. Now, I want to go back to something that you mentioned as far as people that are on their feet a lot tend to develop, or there's a higher chance that you're going to develop spider veins. But if it comes down to more of a circulation issue, could you explain kind of how does that make sense? Like if you're on your feet all the time, I would think that you're getting more blood flow because you're moving your feet around a lot. I would kind of think someone who's just sitting all day long would have a higher chance of developing spider veins. But what's that? I guess what's the piece that I'm missing that if you're on your feet and moving around that you can develop spider veins?
Well, that's actually a good point. But the thing is that just because you're moving around a lot and you doesn't mean that you're wearing the proper shoes. So you're causing some trauma, some damage, which tends to send more blood down to the area because of inflammation. And if you have more inflammation in an area than what your body is capable of returning back to the heart, you're going to pull blood, just as if you were sitting for long periods of time. And right, people who sit for a longer period of time are going to typically have these problems more often than somebody that doesn't. But as I said, so many of us wear the wrong shoes, the wrong socks, or we're not really doing a whole lot of moving. Like when you work OR, I'll take, for example, you're standing stagnant in that place for hours, sometimes depending on the procedure. So that in itself isn't really great circulation. You're just really standing up for the whole time, 6+ hours sometimes. That's why I didn't like OR. I have to be moving.
I get that. Okay. So then going back to the IV then therapy, like by itself, what is really the benefits of IV? Because I mean, me as just a regular consumer, I've seen IV. Okay, you stick me with a needle, you put some, looks like water into my body, and then I'm supposed to be feeling better. But what really is the benefit of IV therapy?
So the major benefit of IV therapy, number one, is that it's 100% bioavailability. When we eat or ingest supplements for vitamin therapy, at best, we get 38%. That's crazy. I know that is really crazy. And then if we talk about a B vitamin, it can be as low as 18%. And then we talk about people, not trying to pick on anyone here, but we talk about people that have had like a stomach procedure and they've decreased their stomach mass to about 2 cc. So now theirs has even become more decreased. So that is the biggest benefit from IV vitamin therapy. That's why when someone comes into the hospital, we give them a banana bag, because there's no better way than to treat their deficiencies than giving them all these vitamins IV.
Okay. Now, bioavailability, my understanding of that is basically what percentage of what you're taking in can your body really use, correct?
Correct.
Okay. So basically what you're saying is that with IV therapy is that what you're bringing in, it's 100% you're getting the full benefits of it. But when you normally eat just regular food, at best, you're going to get maybe about a third that your body's really going to consume. The rest is just going to be wasted.
I know that kind of sounds sad to say, but it's the truth. Yeah.
So we should all stop eating and just
stop eating. Exactly. I'm like, everybody's gonna stop eating now. No, please eat. It's even you get other things from eating, like your protein, your macros. We're talking about micros when we're talking about vitamins. And people forget about micros. You see all these influencers and get your macros and and I'm all about that too. Don't get me wrong. But we do need micros. I often see people come to me on a meal plan and no one has talked to them about eating spinach, which has got, vitamin C. And of course, it's the fiber and water and all these other great benefits that it provides you. Potatoes, they have potassium and fiber and some protein, et cetera. And I'm kind of going off on another tangent here, but, we really should be worried about our micronutrients just as much as our macros.
Okay. So we talked about the benefits of IV therapy. Now, in what situations do people really come in and want to get IV? Is it really when they're kind of not feeling well, or is it kind of more for, hey, I'm doing great, but I want that extra boost, or is it kind of both scenarios or additional scenarios?
So both and additional. I know that sometimes that's hard for people to understand. Sometimes they'll tell me, well, I feel fine. And then after we give them 12 weeks of IV vitamin therapy and they've stopped taking, they're like, I never realized how fine I didn't feel or how much better I feel now with these vitamins. And that's because we, as I said, we don't really live off this earth like we're supposed to, we were intended to, as our ancestors had to. Everybody was growing their own foods. They were picking their own foods. They were walking for miles. They were gathering to build chapels and homes. So they were getting lots of exercise. And in today's world, and, nobody should be, I'm not trying to offend anybody by this either, but we are living off convenience. So we drive through the drive-through and then we have to go to point B and then take our kids here and we're eating in the car and et cetera. I mean, I've been guilty of it. And in fact, until I started doing this, that I realized I needed to take this phrase out of my life. But we would always say, oh, they're young, they can afford it. And the truth is the younger you are, the more you need to be vitamin efficient, because your brain is growing, your bones are growing, your body is really trying to thrive. And so we tend to counsel our kids out and say, oh, they don't need that. I've seen people buy themselves like pH balanced water or spring water that has electrolytes in it, and then their kids get, something that doesn't have it. And the truth is we all need electrolytes. And in the day, we used to all receive our electrolytes via spring water or natural sources of water, and we don't do that anymore. So people are becoming even electrolyte deficient. I run labs, and you should see how low people's sodium chloride is and how low their potassium is, their magnesium, when if they just drank some spring water or something, that have pH balance, it would provide them a lot of electrolytes.
Okay.
Which is very important too.
Yeah. So when someone's looking to get the benefits of IV therapy, is it something that they just come in and it's like, just load me up with everything? Or do you take like a test first and do labs and be like, okay, hey, you're actually really good at this, but you're lacking this, and this, that's what we're going to give you the IV therapy for?
Yes, sorry, I didn't mean to cut you off. So I prefer to do labs because I do run a panel of vitamins. And of course, I check their hormones as well as other things like their kidney function, liver, etc. But there's oftentimes that they kind of just know what's going on, or they're looking for a certain type of treatment, and I will treat those as well. But I do a complete physical and history. We discuss their symptoms, what's been going on, how long it's been going on, if they've ever had these symptoms in the past, and if they've gotten worse. So my preferred way, though, is, of course, to get a full lab panel. That's what I really like to see. Because when we do a full lab panel here, I like to run vitamin D, B1, which is thiamine. And you wouldn't believe what an issue that is in this country nowadays. It's very hard for people to consume. And then we have all these people that have been having the stomach surgeries. And that actually is a very hard vitamin. I don't know if you've ever heard of WKS, which is Wernicke-Korsakoff syndrome. And people who have had like a stomach surgery where they've decreased the size of their stomach, they don't absorb vitamin B1 very well. And that's a very important vitamin. It's very important for our cognition and our thought process, and so that we don't get cloudy and foggy. And I don't know if you've ever known anybody that's had that surgery, and you see them like 5 years later and you're like, wow, she's just different. There's something odd about her or him, whatever. And it's typically because they become very low in thiamine B1. So there's other vitamins, folate. I like to run iron. You wouldn't believe how many people are deficient in iron now. And the reason for that is because we are a meat loving nation. We really are. But when people don't understand, and I've seen people, this happens to them all the time, they'll be prescribed iron by another physician, and that physician failed to tell them that the only way you really can absorb iron is if you consume enough vitamin C. So they're taking all this iron and they're really not getting the benefits of it, and they're getting constipated, and then they stop taking the iron. So then they're back in the same place that they ever were. And then if they eat red meat and they don't know to eat the vitamin C with it, then they're really just getting high triglycerides. Lots of protein, but high triglycerides.
Interesting. Okay, that makes a lot of sense then. Now, when it comes to what you're putting in them with the IV therapy, is the quality of that IV, or I guess the solution or whatever you call it, is the quality of that really important, or is it kind of standard across the board? Like everyone kind of has the same solutions that they're using for their clients?
No, there are some solutions that have preservatives in them, and I stay away from those as much as possible. It's like taking an oral vitamin that has lots of fillers, to me, in my book. And if there's also people who have allergies to those preservatives, so I really try to do my best to stay away from them and use something that's preservative free. Reactions can occur, especially if we're giving this IV. That can be a little scary for somebody who has an allergy.
Good to know. Okay, so quality.
And then of course, like if we're I'm sorry, go ahead. What were you gonna say?
Yeah. So the quality of product is really important. Also understanding, is there something and that's why you do the labs, I'm assuming, to kind of figure out, like, is there potentially could be an issue for them, but you're also using just a really good quality product.
Yes. And something I failed to mention. So let's take B12, for example. There's cyanocobalamin and methylcobalamin. And cyanocobalamin, I could give you 10,000 IUs over and over and over, and honestly, your body won't utilize it. Your body will excrete it. Whereas something that's methylated, your body will store and utilize at a later date. So if someone's looking for a B12, we carry methylcobalamin here. We do not use cyanocobalamin. It is a much better product.
Okay. So what would you advise to somebody who's thinking about getting some type of treatment done, or like an IV, but they're not sure who to go with, which provider to choose? What's the most important piece of advice you can give to somebody when it comes to choosing a good provider?
I would say their knowledge behind the vitamins that they're giving them. I think that's very important. I mean, we can all say we offer something, but do you really know what it's used for and what it's going to do for me, and how it's, how well you're going to react to it, et cetera. I think that's very important. I've been doing IV vitamins now for I started doing vitamins right before I became a nurse practitioner. So I've been doing them for 7+ years. And a lot of people do them now. But I see that a lot of people really haven't taken the courses just because they're a provider. They write a prescription, and that's okay. But I really wish people would learn more about them, really. And let's take niacin, for instance. In our body, it can help us make tryptophan and also turn into NAD, which is a very important antioxidant. I don't know if you're familiar with NAD, but
Yep.
it's made a big, yeah, like, people are really after it these days.
Yeah.
But like I said, niacin, I love niacin. I don't know if you've ever had niacin. Not niacinamide, because they're similar, but niacin. You should really try it. It'll cause you this big flush. You get red. You feel itchy, but it's amazing stuff. I like it.
Okay, good to know. Now, Andrea, I'm curious, what role do you believe creativity plays in how you approach your client care? Because I mean, when people think about medicine, I think especially for your background, like you've done so much in the medical field that I think you're so used to, like, there's these processes, there's these procedures, there's these protocols. Do this, so you don't kill this person. But what role does creativity play in what you do?
Oh, a lot, because everybody's different, right? And everybody reacts different. Also, some people don't like the way something feels. Like, let's take the niacin, for instance. I will always say that if I give someone niacin and they have like that super, like, oh my God, this hurts, I didn't like that feeling, then they're very low on niacin. They don't consume it probably at all. Right? Because if you're consuming something quite often, then your body's not going to get that major reaction to it. You're going to get that nice flush and you're going to enjoy it. Whereas sometimes it can be painful because it hits them in their gut and then they get super red and irritated. So you do have to kind of just play it out and start with smaller doses. I always like to be reserved when I start vitamins or anything that I do, Botox, filler, whatever it is, sclerotherapy. Because you want people to have a good reaction, and then less is always more, and you can always go back and retreat. You can always increase the dose. So that's what I like to do. I think you really have to play with them a little bit, and that might not be the best phrase to use there, but really, we really just have to kind of take it slow. Got it. I hope I answered that.
Did I answer that? Okay. Yeah. Now, Andrea, I'm sure that over your career, you've probably had some tough cases that you've had to deal with. Is there maybe one story that comes to mind of just kind of a tough case that stands out and how you were able to get them a great outcome in the end?
Well, I do. I have a lady that came to see me, and she was my client for 3 years. She had a sister that went and had a stomach procedure, and they were both overweight, and she wanted to lose weight, but she didn't want to go the same route. She saw the difficulties that her sister was having, so forth. She wasn't able to eat. She was constantly sick. And she tells me, she's like, I want to lose weight, but I want to do it what she, says the right way. So we put her on IV vitamin therapy. We started hormones for her, and she lost over 100 pounds in my clinic.
Wow.
And she still looks amazing. We talked about nutrition constantly. We talked about exercise, weightlifting, and of course, a little bit of cardio, things like that to keep her going, keep her blood flow going. And then she eventually had skin removal surgery, and she's just a different person. She's so happy. She's a much different lady. I love seeing her out and about. She's got confidence, and it was just a great thing for her and for me. I take a lot of pride in that, and it makes me very happy when I get to see her.
Yeah, it's a great story. I mean, weight loss is not easy, and for someone to be able to hit that goal and do it the right way, which is the most important, I think it's great. It's very inspiring also.
And she was dedicated. She came weekly, every single week, like clockwork. She didn't miss an appointment. If she couldn't make the day, she'd call and reschedule. So kudos to her, because I can tell you what to do, right? And I mean, I could drill it and those things, but unless you really do it on your own, that's it's all up to her. So she did good. She did amazing.
Excellent. Now, Andrea, where do you think the future of aesthetics is going?
I don't think they're going natural, and I will say that's okay. To each their own. Everybody has their own preference, and they're entitled to that for sure. I have lost clients, though, I will tell you, because I prefer to keep and maintain a more natural look on people. And, if they want to go elsewhere, I understand that, but I do like that more natural look. And I think, specifically with the aging population, people like me, 40 and above, we like that look. And that's where I try to stay. Of course, if someone comes to me and they want me to give them a little more filler than what I recommend, as long as it's not crazy, and it's not going to make me look like my work is a joke, I guess you could say, for lack of a better term, then I'll do it. But it has gotten a little Overzealous, I guess.
Yeah.
I don't know what's the right word.
I think that's a good way to describe it. It's a good word. Okay. So, and I'm curious, Andrea, what's your vision for True Health, your practice?
Well, I want to retire here. This is what I want to do for the rest of my life. I love helping people this way. Especially when it comes to like I said, I've always loved the aesthetic part because it makes people feel good, and to maintain someone's beauty, to help them restore it, return it. Because sometimes, especially like me, I loved to sunbathe. I was in the sun in my 20s like crazy, dried out my skin, etc.
Mm-hmm.
But I do want to be here, especially now that I like with the vitamins, because it's so important. And of course, I didn't learn this until I was in my mid 30s, all this nutrition stuff, but it's really an avenue that we should be reflecting on. And I think it's a better way to treat people's health. We mask a lot of people's symptoms by giving them a prescription. And I'll take iron, for example, and people don't often know this, but iron is one of the major causes of anxiety and depression. And people are prescribed anti-anxiolytics often, when if we just maybe treated their iron. Now, you're going to give them one bag. Is it going to completely take it away? No. And there's some people who are more anxious than others, right? But if you're more iron efficient or more, nutritionally efficient, you're going to function at a better rate than others. So I really feel like that's very important. And then, of course, the hormones, because what people don't understand is through our diet, we consume a lot of our hormones, or that help us make these hormones. And if you have a lack of nutrition, you're not making enough hormones, and those two really play a role together. I know we are always talking about exercise, those things. And yes, of course they do. They help us make more testosterone and et cetera. But nutrition is where it's at. I really think people should really start focusing on their nutrition so we don't have to do a Band-Aid anymore for it.
Oh, great advice there, and great vision. It sounds like you really found your calling where you are now.
Thank you. I appreciate it.
Yeah. Well, Andrea, I have one last question for you, but before I ask it, I do want to point people to your website at truehealthcbad.com.
Yes, sir.
Last question is, what does beauty mean to you?
It's in the eye of the beholder, honestly. I think that whatever makes you feel good, whatever makes you sparkle, whatever makes you get out of bed in the morning, what makes you happy and confident, I think that's what beauty is. It doesn't necessarily mean that I think someone's handsome or pretty, but if that person feels really good about themselves, they're going to be more confident. They're going to be more apt to go out, to exert energy, which we all know that even walking and creates endorphins that create a perpetual cycle and makes you want to do it over and over again. So beauty, I think, is those things.
Okay. Well, there you have it. Andrea sharing her expertise. So Andrea, where can people contact you in your practice?
So they can call our office, or they can visit us on the website, and they can book an appointment that way. Do I give my number?
Yeah, you can give your money. That's fine.
Okay. 575-725-5936.
Okay, awesome. Well, Andrea, this is great. Thank you for coming on. And thank you for sharing your message.
Thank you, Daniel. It was great meeting you.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.